My name is Miguel Miranda. I'm a Portuguese neurologist, and I also work here at the program committee of EAN. I had the privilege of moderating the late breaking news poster session here at EAN 2026. One of the presentations at the poster session was actually the data from the interim one-year analysis of the ROSSINI study. So ROSSINI is a real-world study of utilization of Foslevodopa, Foscarbidopa. So, as you know, advanced Parkinson's disease is characterized by significant motor and non-motor fluctuations that are usually not well treated with oral medication. And so for these patients, we need to offer other kinds of treatments, the advanced therapies, in which we include DBS, apomorphine, duodopa intestinal gel, and then right now we also have this option, the subcutaneous Foslevodopa, Foscarbidopa. The Foslevodopa, Foscarbidopa option is for continuous dopaminergic stimulation for a 24 hours period, so this is quite new. And AbbVie actually presented the poster with the real-world data from 1 year of follow-up of patients in this real-world setting. And pretty much what we saw is that we already had the interim 6 months analysis, so we already knew that patients under Foslevodopa, Foscarbidopa had great motor benefits. They have a very significant reduction of periods, and they have an increment on periods without troublesome dyskinesia. But now we have a longer follow-up, which pretty much shows that the benefit is sustained throughout the year. And we also see what we've already seen in the 6 months interim analysis, which is great non-motor symptoms impact. These patients report an important reduction in pain scores, in sleep scores like the PDSS-2 scale, and they also have a reduction of nocturia. The colleague also told us that in this 1 year interim analysis, patient reported even higher PROMs when it comes to health quality of life, which is very, very significant. And then when we look to this 1 year follow-up period, we also see that the safety profile of Foslevodopa is fantastic with, we have some infusion site reactions, we have hallucinations, of course, because we are talking about continuous dopaminergic stimulation, but they are quite easy to manage. So these are the big takeaways from this presentation. I would also say that during this 1 year follow-up period, we also noticed that there's a slight increase in the levodopa infusion dose, so, which pretty much is rather modest. So patients tend to remain rather stable throughout the year under Foslevodopa, Foscarbidopa. So these are my main takeaways from the presentation. Moving on now to the headaches field. As you know, for the last decade, the preventive treatment of migraine has changed enormously. We used to use drugs that were non-mechanism specific and had a lot of side effects and were not very effective. But then there was the development of anti-CGRP therapies, which are very, very helpful, very effective. Despite having a few anti-CGRP therapies, which have changed completely the way we treat migraine, we still know that around 40% of patients do not meet that benchmark of 50% reduction in migraine days, and we also know that a few patients actually do not respond to these therapies. So it's rather important to also have other mechanism-based treatment options for these patients, and that's where anti-PACAP treatments come in. So this is a new class of drugs that target PACAP, pituitary adenyl cyclase activating polypeptide, which is a neuropeptide that is relevant in migraine, is also a vasodilator peptide, just like CGRP. So what we have seen during the poster presentation was pretty much a collection of data from the HOPE and PROCEED trials. The PROCEED trial is a phase 2 trial that tried to establish what was the best route of administration of Bocunebart, which is the first investigational anti-PACAP monoclonal antibody. So we saw that the most effective way of administering this drug was by IV and not subcutaneous, and by using it in an intravenous way, we are reducing side effects and we are achieving higher efficacy with this treatment. It's important to say that patients that were selected for this trial had rather hard to treat migraine profile. They had failed at least 4 preventive medications, but only a few of these patients had tried anti-CGRP therapies. That was something that I asked the colleague that presented the study. But still, Bocunebart showed a good safety profile, especially when administered in an intravenous way, and it was effective. So the primary endpoint was met. The efficacy primary endpoint was met against placebo. So now we move to the dementia field. When we talk about dementia, we are always on the lookout for new biomarkers, especially blood biomarkers that could eventually help us to detect which patients might suffer from brain aging, neurodegeneration. That's the idea. During the poster presentation, a colleague presented an interesting longitudinal and observational study about the potential of a molecule GDF15 as a possible blood biomarker of brain aging and neurodegeneration. So what he has done was to look at a cohort of 400 community-dwelling elderly patients with a mean age of 70 years old. These patients had no diagnosis of stroke, had no diagnosis of dementia, and they were followed throughout 6 years with serial MRIs, and they had their blood collected multiple times throughout the follow-up period. And what the colleague has found was that patients that eventually developed atrophy, brain atrophy, global brain atrophy, amygdala, hippocampus brain atrophy, and even more white matter lesions, hyperintensities, actually had higher baseline levels of GDF15. So GDF15 did indeed appear to be a rather good blood biomarker of brain aging, and this correlation was still found even after adjusting for the genotype of ApoE, and even after adjusting for the values of p-tau 217, which probably means that this biomarker represents another pathway of neurodegeneration, that it's amyloid and tau independent, so it can be quite relevant, I would say. But this data still needs to be validated in other studies, of course, but it can actually be very interesting to identify people at risk, especially elderly patients at risk of neurodegeneration, in order to offer them lifestyle modification measures and eventually enroll them in clinical trials.